By the way, do we have any questions before we get started? Anything at all? Secret of life?
We're starting sideline massage, right?
Are you?
I think. I don't know.
If Mystery Bar said you are, you are. Yeah.
Okay.
Yeah.
I can wear makeup without it getting ruined.
I guess that's true. I never even thought about that. That is another good reason for sideline massage. I'm not kidding. I remember at the resort, we'd get people would come in and they'd be like, I know this is hard, but don't mess up my hair and my makeup because I'm going out at night. And it's like, I mean, that makes sense. They're at a resort. And so sideline might be a good alternative for people that are all glammed up. Yeah. Yeah.
I have work to do, so gotta.
Yeah. So, by the way, just to let you all know, one of our massage theories, it's a theory I really believe in about teaching massage itself, about learning how to rub people, is that if you put students in situations where they just have to do things differently, then they tend to become very creative and they start teaching themselves massage. Because there's kind of, so sideline is an opportunity for that. That's why I'm saying this. Sideline is just something new. It's not even, me personally, don't really care if you learn sideline massage or not. I care that sideline massage stimulates you to think about massage from a new angle. Does that make sense? And I believe there are two types of massage therapists in the world. And they can both be good, but only one can be great. The one kind is the type that you teach a pattern to, and they kind of do this pattern, and when we stick them in a room, a massage room, and give them 1,000 clients that year, and we come look at them at the end of that year, they're about the same as they were when they started. They're still kind of doing that pattern, and they might have refined it a little bit, but it's still really kind of the same thing. And then there's another type of massage therapist who's very experimental and says, well, let's try this, and let's just think about this, and I know this thing about this other thing, and I want to try this in sideline, but they're face down now, and maybe it'll work, and they're that type of therapist. And if we feed that therapist 1,000 clients, in a year, they are a radically different therapist. They're able to self-teach themselves. They're able to create new moves, they're able to self-teach, and they tend to get very, very good with volume. Extremely good. So that's what we want to do with all this stuff. So if we show you Thai massage or something, some moves from that, we're actually not doing it so much to teach you that particular massage. We're doing it to get you to think creatively about the human body so that you start inventing your own stuff. So I'm just telling you that as like a pep talk to please try crazy stuff out in lab. Because if you won't try it in lab, I say this to every class, if you won't try it in lab, you'll never try it. It'll never happen. Ever. That I guarantee. Because if you're afraid to try it on your lab people, you're not going to try it on somebody paying you $80 for the massage. It's just not going to happen. So start getting used to doing it now and just try different stuff. Try massaging with one hand. If you're right-handed, try doing a whole massage with your left hand. Try doing a massage without your thumbs. Try doing a massage with your eyes closed. When we come in and teach you about feet, which we will do again, sometimes we'll have you massage feet for 2 hours. Because you get very good if you get very bored. You start trying new stuff just out of desperation. But it's good desperation. All right, sorry, that's my little massage pep talk that I really believe in. Okay, so the spine and thorax, right? The spine and thorax. Let me grab one thing. I need my spine thing over here. Sorry. Okay. Need my little mini vertebrae here. So the spine and thorax, Miss Hanson, this is a little out of left field, but what is the thorax? What does that mean, that term? I've never asked this.
It's at the front of the body.
Well, it's the thoracic region. That's the thorax. So what's the thoracic region?
It's the ribs, right?
Pretty much. There you go. That's what I'm looking for. It is the vertebra and the ribs and the sternum. But you're right. It's everything associated with ribs is your thorax. Front and back, by the way. Well said. Cool. And Miss Monreal, what is the spine?
Like, what do you mean? What is the spine? The vertebrae?
Yeah, good. I wasn't looking for a particular answer. I was just looking. Can you organize the information in your head? Like, if I was a 5-year-old, how would you explain the spine to me? So it's the vertebrae. So it's these little bones stacked on top of each other, right?
Yeah.
Cool. All right. Miss Yanez, what do we call vertebrae up in this area here?
Cervical.
And how many do I have?
7.
Yep. And
Yeah.
and what is the top one called? There are two.
C1 or axis, right? Atlas.
Yeah. What's C2 called?
That one's the axis.
Cool. And do you remember what C7's called by some people? It's the most prominent vertebra.
Vertebra prominence.
Yeah, that was great. Thank you. Cool. Ms. Torres, how many thoracic vertebrae do I have?
12?
Yeah. How many pairs of ribs do I have?
12.
Yeah. Hey, the first 7 ribs insert directly into the sternum. What are those first 7 ribs called besides 1 through 7? Yes, they're called true ribs. Thank you. And the next, 7? Next 3 attach to the 7th one and then go in to the sternum. So what are the next 3 called?
False ribs?
Yes. And the last 2, 11 and 12, don't attach to anything at all. What are they called?
I forgot.
Well, I'm just gonna kind of drift and float here while you think about it.
Oh, floating ribs.
Floating ribs, that's it. Cool, thank you very much. Miss Hunter, what are the vertebrae down in this low back area called?
Lumbar?
Yeah, how many do you have?
Is it 5?
It is 5, yes.
Okay.
Although some people have 6, but that's a whole other story. But 5 is the answer. 5 is the answer. 5 is the answer. What's the first lumbar vertebrae called?
L1?
Yeah. What's above L1?
T12?
That is 100% correct. Thank you.
Oh.
Thank you. That's 100% correct. What's the last lumbar vertebrae called?
L5?
What's underneath it?
The sacrum?
The sacrum. Yep, absolutely. That's
Okay.
absolutely fine. S1,
I
sacrum.
You're gonna trick me.
No. I know. Sorry. I mean, yeah. Anyway, I was not successful in tricking you, so that's good. That's good. Very, very cool. Awesome. Thank you, Miss Cooper. What's this flat bone here called?
That's the,
Starts with an S. Miss Cooper, I don't want to have to get stern with you about this, but I need you to answer this question.
with the sternum.
Yeah, that's it. That was good. Up here at the top of the sternum, it's still the top of the sternum, but it angles back. This is called the sternal angle. And this last little part angles back to hook up to the first rib. And it's got a name too. So it's technically part of the sternum, but they named this top part up here too something. Just lay it on us, man.
The sternoclavicular.
Well, I love what you said. This is the sternoclavicular joint. Thank you. Like that's actually not what I was asking, but an excellent answer. No, just what do you think it is? This area up right here. Just tell me, man.
Mandibular.
How about manubrium?
Manubrium.
Yeah. Yeah, good, cool. And down here, by the way, these are hard because I don't think I've asked anybody these in a long time, but we're just kind of doing a little review. Down here is a little pointy thing. And it's got a name. I'll even tell you the first letter because it's not going to help you that much. The first letter of the name is X. But it sounds like Z.
It sounds like what? Wait,
Z.
sorry.
Z. The first letter sounds like Z, even though it's an X. Little pokey thing. You can feel it on your own body.
Your
Xi. Void. Void.
Zavoid?
Xiphoid.
Xiphoid. I always want to say xylophone.
Yeah, that's close. So your xylophone process, well, let's call it xiphoid. Your xiphoid process is right down here too. Yep. Later we're going to discover that your diaphragm hooks to that. It's one of the reasons it's significant. Very, very good. Thank you, thank you, thank you. Cool. Oh, hey, Miss Cooper. Good job. Mr. Yen. Mr. Yen, I want to review what Miss Cooper just said to make sure everybody got it. What's this bone here called?
Sternum.
Sternum. Bam. What is this top part of the sternum called?
Top in the core in the menu, real, I don't know.
You are saying man, new, brium. Beautiful. Manubrium. Beautiful. And what's this little pointy process down here called?
I think right boy breast.
Process. Xiphoid process. That was good.
Right boy breast.
Cool. Thank you, thank you, thank you. Miss Stanley. What's your collarbone called?
The clavicle.
Yes. And what is the joint between the sternum and the clavicle called?
Sternoclavicular joint.
Yes. And what is the joint between the clavicle and the acromion process called?
Acromioclavicular joint.
Yes, acromioclavicular joint. Cool. And what is the joint between the humerus and the glenoid fossa called?
Glenohumeral joint.
Thank you very much, ma'am. Miss Felix Osuna.
Yes.
What is the joint called? It's one of the three you just heard, by the way. That is the only joint that attaches the entire shoulder girdle complex onto the body, onto the thoracic region. There's only one joint that actually attaches your entire arm and shoulder girdle region via a joint onto your body.
Is it the clavicula joints?
The what?
The clavicula?
I think you just made up a joint. I didn't hear what you said.
Oh. I'm looking at my notes right now.
Okay. Well, it's either, actually, it's this one. It's where the clavicle attaches to the chest. What do you call that joint? Or where the sternum attaches to the clavicle.
Is it the sternoclavicular?
Yes, sternoclavicular joint. And the reason I made that question, everybody, was just to remind you once again, all this stuff back here is all suspended by muscles off the back of your head, but there's no joint hooking it together, right? This tiny little wimpy little joint of your collarbone is the only thing that holds your entire arm on via a joint, a bone-to-bone connection. It's really all the strength and all the way your shoulders work is because they're suspended from your head and neck. It's a very dynamic area. It's very, very interesting. Okay. Stay right there, Miss Felix Osuna. Like you're going to go somewhere. I don't know why I was saying that. What bone is this?
It's the scapula.
Yes, it is the scapula. And we are looking at the back side of it, which is what you normally massage in a way. What's this thing sticking out back here? Runs along it like that.
That's the spine of the scapula.
It is, and it's going to turn into the what?
The The supras. Spinosa?
Oh, well, that's above it. But if I follow the spine of the scapula, it turns into a process out here that's kind of your shoulder pad.
Is it the acromion process?
It sure is. If I go to the front of the scapula, there's this pointy beak-like projection. Do you know what this is called?
Wait, can you point at it again?
Yeah, it's right here. You can feel it in front of people, right up here. It's a process too.
The coracoid?
Coracoid. You just said beak-like, by the way. Coracoid process, which is a beak-like projection. Thank you very much.
Mm-hmm. Thank you.
Miss Harper.
Yes, sir.
What's this angle here called on the scapula?
Angle. It's the superior angle.
Yeah, what's this angle called?
The inferior angle.
Yeah, what's this border here that's close to the spine called?
That's the medial border.
Yes, ma'am. What's this border out here called?
It's the what do you call it? The side, the lateral border.
Yeah, perfect. That was great. Thank you. Miss Bilotic.
Yes.
What? Just the way you said it. I don't know why it's funny. Yes. What's the fossa above the spine of the scapula called?
Like the divot?
Yeah, it's a fossa,
Mhm.
and it's called the something fossa above the spine of the scapula.
The supraspinatus fossa?
Yep, supraspinous fossa. Beautiful. We'll take it. What's the fossa underneath here called?
Underneath it?
Yep, below it.
The infraspinosus?
Yeah, infraspinous fossa. We'll take it. What is the fossa underneath the scapula called? It's actually on the anterior side, but it's underneath.
The subscapular fossa?
Thank you, ma'am. It's been a pleasure. Mr. Kondaris, what is this fossa called? This is the fossa that receives the humerus. Starts with a G.
Glenohumeral.
Well, but what's the fossa called?
Uh,
You basically said it.
is the start with a G?
Yeah, you basically said it.
Glenal fossa.
Glenoid fossa. Yep.
Glenoid fossa.
Yep. Glenoid fossa, and you are right. It will eventually make a joint called the glenohumeral joint. Right? Glenoid fossa. Cool. 2 more questions, sir. There is hold on, let me think about this. Is it protuberance? I got to remember now. There is a tubercle above the glenoid fossa that actually the long head of your bicep inserts into. But anyway, what's this tubercle called that is above the glenoid fossa? Above the glenoid fossa.
It's not the greater tubercle, is it?
No, that's on the humerus.
Okay.
Yeah.
So,
It's above. That's my clue. Above the glenoid fossa. Supra glenoid.
Supraglenoid fossa.
Supraglenoid tubercle. This one. Yeah.
My bad.
Good. No, you're fine. And one last question. Remember the question you just answered because it'll help you. What's the tubercle below called?
Infraglenoid fossa tubercle.
Yeah, you nailed it. Thank you, sir. Nice reasoning. Cool. Miss Petrie.
I'm sorry, before you move on to the next one.
Yeah.
So what attached to the supraglenoid tubercle?
Well, I know.
This one?
I'm so embarrassed right now. I know for a fact one of your biceps attaches to it. I was trying to remember if it's the long head or the short head. I actually think it's, but hold on, give me a second. It's the short head of the bicep brachii that tendon attaches in there.
Okay.
Can anybody check that in their book to make sure I didn't mix that up? But I think it's the short head that attaches into the supraglenoid tubercle. I know it's the bicep. It's kind of frightening that I'm your teacher right now.
No, it isn't.
But anyway, it actually reaches up, just so you know, ma'am. It reaches up. This is kind of cool, actually.
It's frightening me that you're my teacher.
I don't. It frightens me. You're my student. The bicep is right here in front on the humerus, and the short head tendon actually goes up between the interturbicular groove, which is the groove between the greater and lesser tubercles here. And the interturbicular groove is also called the bicipital groove because of this reason. And then it goes up over and inserts into the supraglenoid tubercle. And people can actually pop out their bicipital tendon here, and somebody has to pop it back in. And then another tendon goes over here from the biceps brachii muscle and attaches into the coracoid process. And I think that's the long one. I hope. Has anybody confirmed this yet? Maybe. Anyway, the biceps definitely attached to those two areas. Yes. Yes. And by the way, Miss Morel, just since you're asking,
Yes.
do you know what attaches into the infraglenoid tubercle?
No, I wanted to ask that also, but I thought, well, if you didn't remember the other one, I don't know.
I remember the bicep brachii. I just couldn't remember which brachii went to where.
Okay, yeah. No, I don't.
The long head of the triceps.
Long head of the tricep. Yeah, I was.
So you got a
wondering-
bicep above and a tricep below.
Okay, great. Thank you.
Yes. And I think it's long head of the tricep inserts into the infraglenoid tubercle, and short head of the bicep inserts into the supraglenoid tubercle.
That's the long head of the bicep too.
Ah!
That goes into the-
Okay. All right, everybody. So it's long head on both. Long head on both. I was trying to visualize it too, like how it's called long head because it's longer. And I was like, well, is it longer going this way or over this way? Okay. So long head of the bicep. Sorry.
Well, the cool thing is that I'll always remember it now because I'm like, wait, which one couldn't you remember? And it'll be ingrained in my brain.
That's a very kind thing that you said, that my mistake will help you remember. They say it's terrible if you do what I just did as a teacher because, now I've given it to you both ways. But anyway, what we can all remember is that the long head of the biceps brachii inserts on top and the long head of the triceps brachii inserts on the bottom. So we'll stick to that. Okay. Very good. Thank you. By the way, thank you, Ms. Janes, and thank you, Ms. Monreal, for your kindness. I appreciate that. I think I was calling a Miss Petrie before we found out that I can't answer my own questions. Miss Petrie, what bone is this? Don't make a joke.
The humerus.
Yes, ma'am, it is. Thank you. There is a big bump on the humerus off to the lateral side of it. Do you know what that big bump is called?
The greater tubercle.
Yes. Do you know what the little bump is called?
The lesser.
Yes, ma'am. Do you know what the space is between the two? There's a groove between the two.
Oh, the
Between the two tubercles. I always remember because I think of interstate transport, which is transport between states.
Is it an infratubercle?
Inter, which means between, believe it or not. Interturbicular groove, also known as the bicipital groove, because the tendon goes through there.
Okay.
Yeah. Good times. Thank you. Miss Hunter. At the bottom down here is where my elbow kind of forms. And I've got bumps out on the side. Do you know what those bumps are called?
I don't.
You can feel Well, Do you know what they call the center of an earthquake?
Oh my gosh, no.
Do you? That's my only clue, man. That's the only thing I got. Um, these are condyles.
Can I give her a clue?
Go ahead.
Yeah, please.
Think of the word epic. Is that ringing a bell?
No.
Yeah.
Or can I throw it off? What if I got it wrong?
These are called condyles or epicondyles. Epi is like the really
Epic.
pointy part of them, but most people call them condyles.
I don't remember ever learning that, so I'm so sorry.
No. Well, we haven't done a lot with it because we haven't gotten to forms yet, and forms are what attaches to these condyles. I'm just trying to kind of keep this. Yeah, you're right. So I haven't talked a lot about it. Really quick question. You've got condyles on both sides. What do you suppose you call the condyle on the outer side of your arm?
The lateral condyle?
Yes. And what do you call the condyle on the inside of your arm?
Anterior condyle? No, not anterior.
On the inside of your arm? You just told me this was lateral. What's this one?
Yeah, I know what that one is. Lateral, I don't know. God. I thought it was anterior.
Well, that's front.
Oh.
Posterior. Lateral. What's this?
Oh my gosh.
This one is more towards my midline. It's closer to my midline.
Oh, proximal? No, it can't be proximal.
Well, it could be proximal to something, but that's not what we're talking about.
Oh my God. How did I forget this?
I don't want to tell you because you're gonna be like, I can't believe. What's the opposite? What's the opposite of lateral?
What is the opposite of lateral? I don't remember. Hold on. No, it's not frontal. I have no idea.
I love that frontal.
Forget the inside.
Starts with an M. More towards the midline.
What?
Starts with an M because it's more towards the midline.
Medial?
Yes!
Thank God.
Lateral and medial. All right. Good job. That's good. Awesome. Okay, everybody. So, I actually don't think... Miss Monreal, let me ask you some questions for a change, young lady. So, Miss Monreal, when we left our intrepid explorers last week, they had learned lots and lots and lots of muscles, but on the back we had left off with a group of muscles that we had learned about that help keep the spine erect. They actually essentially help you do an extension of the spine or the vertebrae. They can help you do lateral flexions, but what's that group called?
Erector spinae.
That's correct. And what three muscles make up the erector spinae group?
Spinalis, longissimus, and hold on.
Iliocostal. Iliocostalis. Yeah.
Oh yeah.
But that was really darn close. We'll take it. Anybody would know what you were talking about. That's awesome. Which one is most medial?
The spinalis.
Yes. And which one is most lateral?
Iliocostalis.
Yes. And which one inserts into the mastoid process of my temporal bone?
Longissimus.
That is 100% correct. Which one do you think Tapscott cares about most from a structural point of view, even though I've never said this?
Longissimus.
Yeah. Yeah, we're going to find out the longissimus is extremely important because it runs from your butt to your, and I realize that's not correct terminology, but it runs from your butt up to your head. In this mastoid process, we're going to find other stuff attaches to it, like the sternocleidomastoid, and it creates a teeping effect here, and actually in some ways you hang off the back of your head and neck, like I've already talked about. We're going to find this is a high tension area that we really care about from a structural point of view. Yes. So, excellent. Thank you, thank you, thank you. Ms. Hanson, can you touch your deltoids for me? One of them. Thank you. Ms. Yanes, can you touch your upper trapezius for me? Cool. Ms. Torres, can you touch your biceps brachii for me? If I can see you. Can you hear me, Miss Torres? You keep me in suspense. Miss Cooper, can you touch your biceps brachii for me? Your biceps brachii.
I can't. Can you hear me now? Can you see me? I don't know.
I can hear you, but I can't see you. Can you?
Oh my God! See, I have trouble with the camera, so that's
Sorry.
What? But
why I
you're
turn it off.
on top, right?
Well, in anatomical position, it's in front. Anatomical position is kind of if you're opened up like this with your palms facing forward. We'll come back to you, Miss Torres. We'll work it out.
Right in front of them?
Yeah, right here. Biceps brachii. Cool.
Got it.
Miss Nguyen, can you touch your brachialis for me?
Say it again?
Your,
What is your,
it's called your brachialis. The name should give you a little bit of a clue. And it's not in chapter 2, actually. I think it's in your forearm chapter, but your brachialis.
Mama.
I think here.
It's underneath your bicep. It's underneath your biceps brachii. So show me where your biceps brachii is.
Here the bicep and the trachea, right?
Yeah, so here's the bicep on top. The brachialis is underneath it.
Yeah.
But not in back, underneath it.
Oh, and so right here.
So, here's an arm.
Yeah.
This is the biceps brachii on top, everybody. That's the brachialis underneath it.
Oh, and then here. And here.
Yeah, very good. Thank you. Awesome.
Yeah.
Miss Stanley, can you touch your triceps for me? Triceps brachii. Yes, thank you very much. Cool. Miss Felix Osuna, can you touch your latissimus dorsi for me?
Yeah, that would be right here.
Okay, let me see again. There.
Like right here.
Yes, thank you. Well done. Really well done. Cool. Miss Harper,
Yes, sir.
what muscle lives right here?
Oh, that's supraspinatus.
Yes, ma'am. Thank you. Miss Bilotic, what muscle lives under here?
What did you say?
I said, what muscle lives under here? Underneath the spine of the scapula. Below the spine of the scapula, I should say.
I'm blanking out.
It's okay. Miss, while you're looking, Miss Harper, what muscle lives on top again?
Supraspinatus, sir.
Cool. Miss Bilotic, what muscle lives underneath?
Oh, infraspinatus.
Cool. I thought I'd jog you. Cool. Miss Bilotic, anytime I say infraspinatus, you say what?
Supraspinatus.
Something that does the same thing as the infraspinatus. Terry's.
Minor.
Yes, good guess. Infraspinatus, teres minor. They're both kind of in the same place, and they both do the same thing, right? It goes infraspinatus, teres minor, then there's a teres major, and then there's your latissimus dorsi. But anyway, anytime I say infraspinatus, say teres minor. Cool. Mr. Kandaris. Anytime I say teres major, you say
Spinatus.
so. Anytime I say teres minor, you say infraspinatus, but anytime I say teres major, you say
I don't know, I thought it was spinatus. But yeah, you're right, that's the teres minor, because they have the same action.
Yes, perfect. Good job on that. What goes with teres major? It's a powerful adductor, a very powerful adductor and extender of the glenohumeral joint. Very powerful. Probably the most powerful muscle on the upper body. Probably the largest muscle on the upper body. What? Yes, latissimus dorsi, sir. Teres major and latissimus dorsi tend to work together. It's kind of hard to separate them. Awesome. Thank you. Miss Petrie. What are the muscles that kind of run between the medial border of the scapula and the spine of the scapula at a slight upward angle, like this? What are they called?
Is that the rhomboids?
It is the rhomboids. There's rhomboids, there's two of them. What are they called?
Major and minor, but the minor's on top.
You already answered the question I was gonna ask. Bam! Okay. Hey, Miss Hunter. Miss Petrie was kind enough to tell us that there's a rhomboid major here, then a rhomboid minor. Are you there, Miss Hunter? Just want to make sure you can hear me. Miss Hunter?
She went
She went to the restroom.
Oh, she went to the restroom. Thank you. Okay, that's a pretty good excuse. Let's see. Miss Petrie, you're gonna have to pitch for her. So you were just kind enough, Miss Petrie, to tell us about the rhomboid major, then rhomboid minor, then still on the medial border, all the way up, basically at the superior angle of the scapula, is a tiny muscle that goes up and inserts into the transverse processes of C1, C2, C3, C4. It goes right up here, and it helps to elevate the scapula. What is that muscle?
The levator scapula?
That is the levator scapula or the levator. No, you probably said it right. I have no idea. It's the levator scapula, the levator scapula. I'll take it. Thank you. That is awesome. That is awesome. Miss Harper. Miss Harper, underneath my scapula, it attaches to the medial border, but it's on the anterior side. It actually meets the rhomboids back here and actually runs under my scapula here and comes spewing out onto the first 8 or 9 ribs. These like finger-like projections. What is that muscle called?
the subscapularis.
Close. Close. It's
What is it?
the subscapularis is underneath the scapula, but it's attached to the scapula. And it goes over the humerus. This muscle is attached to the medial border of the scapula and attaches into the ribs.
Is the serratus? No.
Yes.
Serratus. What is it? Serratus.
In front.
Serratus in
And
anterior.
yes, thank you. Serratus anterior. Yeah.
Okay.
Cool. Miss Hansen. There's also another muscle that attaches to the coracoid process here and comes down like this with like 3 little projections and inserts into ribs 3, 4, and 5. What is that muscle called?
Pectoral minor.
Yes. The pectoral minor often works with another muscle because both pectoralis minor and this other muscle both like to protract or abduct and depress the scapula. Kind of bring it forward. What is that other muscle that the pectoralis minor?
Pectoral major?
Absolutely not. No. And by the way, I didn't mean to be so blunt, but they're very, very, even though they have the same names, they're very different muscles. But it was a great guess. No, we just talked about this muscle. It would be a muscle that would have to hook to the scapula. Maybe.
Serratus anterior.
Cool. So I'm trying to make associations with you guys now. That was awesome. Serratus anterior and pectoralis minor tend to work together. They don't have to, but they tend to because they both have an action of pulling forward and depressing. Thank you. So to redeem yourself, what is the muscle that argues with those two muscles? That could be antagonists to those two muscles.
Is it in back?
Yes, it has to be in back. I'm already super happy just with that thinking. Because if this is in front, we're looking for something in back 99.9% of the time. Absolutely. So what's the muscle in back that retracts the scapula and even elevates it a tiny bit. And there's actually kind of two good answers to this, really. Rhomboids is the best answer, absolutely. Rhomboids major and minor. And maybe the middle fibers, the trapezius, too, you could argue, too. But that's excellent. So we do know those two things can fight together. Yeah. Miss Monreal.
Yes.
The biceps brachii is often a synergist, which means it likes to work together with what other muscle? The biceps brachii often will work together with another muscle. So they work together. They will often be agonists together.
A deltoid?
Or maybe another muscle that lies underneath the biceps brachii.
Oh, that lies underneath? Brachialis.
Yes, they both create a flexion of the elbow. Beautiful.
Okay.
What would be the antagonist of those two muscles?
What, the tricep?
Absolutely, 100% of the time, all day long. Yep, beautiful. Well done. Cool. Okay. I think that's enough for now. Let's do some new stuff. I just want to kind of review, see where we're at. You guys are doing great, I think. I hope you think so. I think so. I know so. You're doing better than me. I didn't even know where the long head of the biceps went, so we're doing good. But now I do know that both the long head of the bicep and the long head of the tricep insert into the scapula. One inserts above the glenoid fossa, and one inserts below. All right. Let's look at the back. So I hope we're starting to realize the back has all sorts of layers to it. And we care about layers as massage therapists because people that rub backs, just back rubbers, right? They tend to think of things in a very two-dimensional kind of thing. But we want you guys to think more like excavating, like going down to layers and depths of layers. Like a lot of people tell me, oh, I've run out of stuff to do on the back, or I've run out, and I'm like, don't think about it as a back, think about it as layers. Go in deeper, look for stuff down, not out. So let's talk about some of these layers. I kind of made a layers chart here. It is not 100% accurate, but it kind of gives you some ways to think about this. You guys, on layer 1, we learned about a giant triangular muscle right here. Yeah? Miss Torres, what's this diamond-shaped muscle that goes from the what?
Trapezius?
Trapezius, thank you. Trapezius goes from,
What?
you are right, you're right. Trapezius goes from the middle nuchal line here to the linea, no, what's it called? Ligamentum nuchae. The ligament, I shouldn't have taken 5 days off. Ligamentum nuchae, which is a ligament that kind of attaches, by the way, to all your spinous processes of your cervical region, except C1, because C1 does not have a spinous process, and then all the way down to T12. So it really attaches to the back of your head and your spinous processes. And then inserts over to the spinoscapuloacromial process
I thought
in
you
the
were
lateral
doing
lumbar.
that to me.
Oh no, I was doing it to me, because I couldn't remember.
Oh my God, what is it? I can't remember.
Well, that makes two of us. Yeah. Next time, bail me out, man. Don't leave me hanging. So we learned about the trapezius, and we learned that the trapezius likes to work with another muscle to produce these incredible actions in my arm, because the trapezius can kind of rotate my scapula and it can lift it and stuff like that, but this other muscle can actually move my glenohumeral joint and give me abductions and horizontal adductions and horizontal abductions. And what muscle is that's down here on my shoulders, Miss Cooper? This muscle right here. What is this muscle? By the way, it shares an attachment with the trapezius. Shares 3 attachments with the trapezius. Its origin is the insertion of the trapezius. Miss Cooper.
I'm thinking, don't worry.
Oh, okay, sorry. I thought maybe you'd like...
Huh?
Nothing. You're thinking.
Point to it again.
right here. I'm holding it. I'm holding it right here.
Oh, it's your.
Shaped like an upside down triangle.
Oh, your trapezius.
No, I know why you said that, because that's a diamond here. This is over here, though, on your shoulders.
It didn't seem right.
Starts with a D.
Your I almost said Diliocostalis.
Yeah. I'm sorry for this question, by the way. It's just the one you were dealt, and you've just got to kind of go with it.
Yeah. You're good.
I mean, that's the way life is. Sometimes life just deals you a bad thing. You got to play the cards you're
No,
dealt.
You're good. You're
Yeah.
good.
Got to play the muscles you're dealt, I suppose. Yeah. Shh. I'm sorry. Sorry, I shouldn't keep saying dealt. It's almost like I'm dropping a hint or something.
Deltoid.
Yes! Thank you. All right. So, Ms. Cooper, really quick question, just so we can sew this back together. The trapezius kind of hangs off the back of the neck, and these spinous processes here. But anyway, it inserts into this part of your scapula. What's this called?
The spine.
Yes, spine of the scapula. And then this part, which the spine turns into, which is the what process? Starts with it.
Acromion.
Yep, and it keeps going around the bend and inserts into your collarbone, the lateral 1/3 of your collarbone. But we don't call it your collarbone, we call it what?
Your clavicle.
Your clavicle. So you just told me the insertions for the trapezius. What are the origins for the deltoid?
The spine of the scapula, the acromion process, and then the clavicle.
The lateral 1/3 of the clavicle. Yes. So the trapezius and the deltoid share insertions, or they share attachments. The insertion of the trapezius is the origin of the deltoid. Cool. Thank you. So if we rip those off, everybody, we talked about this. If we rip off the trapezius and we rip off the deltoids, all of a sudden we can see some stuff underneath here. This is layer number 2. We can see this Christmas tree muscle here that Miss Petrie told us about. Miss Yanez, what is that muscle right here? Attaches to the medial border of the scapula and the spine of your spinous processes and kind of goes in an angle here.
The rhomboids?
Rhomboids, yep. Yep, which one's on top?
Minor.
Yep, minor's about 2 fingers here, rhomboid's about 4 fingers here. Rhomboids major and minor are at this layer. And there's actually some serratus muscles we haven't learned about yet, and we're not going to yet, so don't panic. But you actually have, remember when I said if there's a serratus anterior, there's got to be a serratus posterior? You actually have a serratus posterior and a serratus posterior superior and a serratus posterior inferior that grab onto your ribs. And they're kind of back at that level. They're actually below the rhomboids, but they're kind of back there. And then if we go down even further, and don't worry about those. We will learn about them later. Then if we go down even further, we get to the 3 new muscles that we've learned. Yes. Miss Nguyen, we learned about 3 erector spinae muscles, these muscles that run up and down your back. The one closest to the spine is called the
I think in the longissimus.
longissimus is not closest to the spine, but it is one of these muscles, so thank you, longissimus. What's the one even closer to the spine? Spine. Iliocostalis is even further out, and that is also correct. You just give me the last one. So we got iliocostalis, longissimus, and then closest to the spine. What's that one called? The last erector spinae muscle, or the first? Spinalis. Good. So most medial spinalis, then longissimus, then iliocostalis. Right?
Yeah.
And there's 2 more muscles, and don't worry about these either. I'm just kind of giving you guys some footing of where we're headed today. There, you have a splenius capitis, which means it hooks from your spine to your head, and you've got a splenius cervicis, which hooks hooks in here too. We'll learn about that later. That are at this level. But if we rip all that stuff off, we get to the fourth layer here. And the fourth layer has a group of muscles called your transverso spinalis muscles. Transverso spinalis muscles. What does that name tell you? Does it hint at anything? There's no wrong answer here. Yeah? This is for anybody, by the way. Yeah, go ahead.
Must have something to do with the spine.
It does. Thank you. Yep, she's 100% right. It has something to do with spine. And it says transverso spinalis. Anybody got any more input on that?
It's like the top part of the spine.
Where are you getting top from?
Transverse. I don't know because yeah.
I appreciate you guessing. Not exactly, because it's all over the spine.
Okay.
But that, okay.
Right.
Transverse. Do you have transverse processes on your vertebrae? Yes, you do. Yes. Ms. Hanson, what are these called right here?
Transverse processes.
Yeah. So these are going to be muscles that attach to the transverse processes. Not that other muscles don't, but transverso spinalis. So it has to do with the spine, has to do with transverse processes, and it is on top, by the way, Ms. Hunter, but also on the bottom too. I think we're going to find it all throughout the spine. So we're going to be looking at the multifidi, the rotatories, and the semispinalis capitis today. Some people say multifidi, but anyway, I always like multifidi. It sounds cooler. Anyway, multifidi, thank you.
Multifidi.
Yeah, I actually think that is the correct pronunciation. I think the high school students started getting me to say it this way. Multifidi, rotatories, and semispinalis capitis. So let's go look at that layer and see what we can find. I love these muscles, by the way. I love these muscles. So, hopefully you can see the slide presentation right now, and you can see the multifidi and the rotatories. These are what I call the shoelaces of the back. Now remember, in this picture, they're only showing you half of them. You've got the rotatories on both sides, but they're just showing you on the right. And you've got the multifidi, I gotta learn to say it right, on the left-hand side. But in your body, you've got them on both sides, and they look like shoelaces that go from your spinous processes to your transverse processes. So they really do look like shoelaces. And they're super important. And they're super important to massage therapists. And I'm very excited about telling you about them, actually, because I think a lot of massage therapists don't really get to them. But you got to remember, this spine, the fact that you can stand erect is quite an amazing accomplishment. Remember, this is 24 vertebrae stacked on top of each other like dominoes. It is very hard to support this, let alone get something where you can carry a kid around or weights or luggage and it doesn't just topple over. And so your body manages this by using layers and layers of muscle to hold this thing together. And we learned about the spinal erectors, the erector spinae group, right? Erector spinae group? Good. Wait a second, just for review. Miss Nguyen, what were the three muscles of the erector spinae group? What were the three muscles that make up the erector spinae group? You just told them to us.
Three muscle, I think, tenomera and tenomere and
The one that's closest to the spine, the really long one, and then the one that goes from the iliac crest. Yeah.
and in the spinal and long
Wait.
long is merg.
And what's the third one?
Cortex.
Good. Okay. Let's just practice them really quick too. Spine.
Spine.
Alice.
Alice.
Spinalis. Cool. Long
Long.
isthmus.
Isthmus.
Longissimus.
Long isthmus.
Beautiful. Ilial.
Ilior.
Yeah, it's hard because of the L's. Costalis.
Costalis.
Beautiful. Thank you. Anyway, so we got those three muscles there. And your body uses those for the power to lift your back up. But it's got to keep all these vertebrae sewn together and individually hold them together. So why not make muscles that are little shoelaces that individually hold them together? And those muscles working together as a group are actually quite powerful. And they can do all sorts of neat stuff. But the multifidi and the rotatories are really like the shoelaces of the back, and there's only two things that distinguish them from each other. And as far as a massage therapist is concerned, you can treat them together. I can't feel the difference in your body. I'm not that good. I don't think anybody's that good. So they work together. They are very similar. The difference is that here's the difference. Let me try to outline it for you. Can you guys see? Maybe I'm going to make this bigger. Sorry, hold on. Try to make everybody's life better. These are giant, crappy vertebrae. There's four of them. This is supposed to be the spinous process, and these are supposed to be the transverse processes, right? Spinous process, transverse processes, okay? The rotatories like to go from one spinous process down to the next vertebrae, or one spinous process, two down. That's it. Multifidi like to go from one spinous process often down to four. They're longer. They're longer. So multifidi, I believe, go from 2 to 4. Rotatories like to jump 1 to 2.
Well, what do you mean they go from 2 to 4? Like one or the other is different on each person, or it alternates?
It alternates. Yes.
Okay.
Yeah. Yes. And it depends on what section of the thing you're in. But basically, the rotatories are shorter. The multifidi are longer. Rotatories either jump 1 or 2 vertebrae. Multifidi jump 2 to 4. There is one other thing about the multifidi. This is your sacrum. The rotatories stop here. The multifidi connects all the way down to your sacrum. It actually covers your sacrum. Multifidi covers your sacrum. Does this mean you can directly rub on somebody's sacrum and provide relief for them? Uh-huh. Do many therapists avoid the sacrum because for some reason they think it's bone and that they should avoid it? Uh-huh. Are those therapists wrong? Uh-huh. Are you going to be rubbing the sacrum? Oh, yes. It's very, very helpful, actually. You don't rub into it. You kind of rub it like you're trying to scrape the meat off the bone. But it's very helpful. Yeah. And you can get to these guys. You can get to the rotatories and the multifidi by moving the spinal erectors out of the way. So sometimes you'll see me do a little movement on a back where I'm kind of pushing like this, and what I'm doing is pushing your spinalis and your longissimus out of the way so I can get below it and get in the lamina groove, which is where you find these guys. They're very easy to find the lamina groove, especially in the lumbar and thoracic region. And I'm getting in there to work in them because, again, they're muscles that people don't usually get to. And they provide a lot of relief. And remember, if they're down here and they're tight, they could be causing tension again on nerve plexes, which could be causing problems over the whole body. So it's a great level to get down to. And if you're thinking as a level therapist, you might be kind of rubbing the surface of the back first. You might let's just give you a theoretical. I might do skin rolling first to get your superficial fascia, which is also your, actually, what are the, Miss Hanson, what are the 3 names for the last layer of skin? You got the epidermis, the dermis, and then what are those 3 names?
Superficial fascia.
That's what I want, yeah. Superficial fascia,
Epidermis.
that's the top one, then dermis, then hypodermis, or underneath the skin, cutaneous.
How do you say it one more time?
Cutaneous.
Cutaneous.
Yeah. So what were those 3 layers again? The 3 names, sorry. 3 names for 1 layer.
Epidermis. Subcutaneous.
Subcutaneous.
Superficial fascia.
Superficial fascia.
And hypodermis.
Hypodermis, thank you very much. So I might do skin rolling on a body first to get the superficial fascia loosened up. I'm not saying you need to do every massage like this. Please do not like this is a very good approach, but I don't do every massage like this. Just give you an idea of layers. But it's not a bad approach. So you could do skin rolling to get the first layer loose, right? Maybe you're doing this with no oil. Then maybe your next thing is to work on the erector spinae group, right? You're going up and down the back with those kind of effleurage strokes, and you're getting that loosened up. Then you might come to the side of the body and actually move the erector spinae that you've gotten loosened up out of the way to dig down into the lamina groove and get to the rotatories and multifidi muscles. So that's thinking in layers. Does that make sense? Yes, Miss Monreal.
Yes, okay, here's the question for the day.
Yeah, oh good, all right.
Okay, so when I try to make sense of things in my head, I guess when I think of like tension and stuff that would affect the muscles, I tend to think like, okay, that's, and correct me if I'm wrong, like usually we feel it like in our traps, or is it just like the superficial muscles? And then I think of like the deeper muscles as, okay, ones that are compromised, maybe by repetitive things that we do or whatever. And again, if this is incorrect, this is just what I try to think of in my head. But then that lower layer, which would be the multifidi, like what would compromise those? Other stuff kind of makes sense to me. It could be tension or maybe incorrect posture or whatever. When we get to the deeper muscles, like what would compromise those?
Okay. Before I answer that question, which I think is a great question, I want to make a comment because you're going to run into a lot of massage therapists, including myself, that get very opinionated about stuff. There's not a lot of research out there about massage, and I've had arguments with massage therapists before about the correct way to do something. And the fact is there's only one correct way, which is whatever works for your clients. And so lots of people are like, well, but so-and-so says blah. I don't care what so-and-so says. I don't care what kind of baloney one of those factoids you pulled out. Do your clients get better and stay better longer than my clients? Then maybe you're onto something. And so there's things that you're asking about. Honestly, there's not enough research out there to know. So I love that you've got an operating theory and that you're willing to adapt it too if you find out it doesn't work. I don't personally think about like some being taxed and some being compromised. I guess one of the things I do think about is I would assume smaller muscles tire faster. And so sometimes I think they cause problems more. Like the levator scapula is this tiny muscle, and I think it kind of bothers people sometimes. I'm not 100% positive about that, but it does seem like these little muscles actually really bother people quite a bit, whereas their large muscles, they're easier to access and they get achy, but they don't seem to be as much of the problem. So I do kind of want to get down these small muscles seem to be trapping small nerves and things like that. But anyway, to answer your question, what would compromise them? I think anything that would compromise the erector spinae group would compromise the multifidi and multifidi and rotatories.
Okay.
Yeah. So I'm not sure if I agree with your theory, but I also don't have any information to disagree with it. Does that make sense?
Right,
Yeah.
that's just the way I try to put it together in my head, whether it's right, wrong, or whatever. I just like to put pictures in my head of what I'm trying to accomplish.
Yes. Well, as you should. So many massage therapists don't have an operating theory, and you should have an operating theory when you're working on somebody. You know, and maybe that operating theory is very simple, like the kind of the one I gave you where I was like, I'm going to loosen up the skin so we get more blood flow going before I get down to this next layer, and then loosen up before I get down to the next layer. But even that's a basic operating theory, right? You know, are you trying, when you do massage somebody, and it might be different for each client, by the way, this does not have to be your operating theory for everybody, but you should all be thinking, am I trying to increase blood flow? Am I trying to stretch the tissue? Am I just trying to relax this person? Like, what is my goal right now? It shouldn't be just haphazard, you know? Cool. So I don't know if I really answered that. I don't know if I really have an answer to that.
Well, no, I just wondered your thoughts on it. And again, like I said, just because that's the way I picture things in my head, I'm not saying like, oh, that's the way it is. That's just my little thing, my little movie I have going on.
I'll tell you my favorite thing about your theory is that it recognizes different muscles and it's going to go looking for all of them. And I like that. Yep. So, for whatever reason, we're down below the spinal erectors, the erector spinae group, and we're down in this multifidi and rotatories group, and you can actually massage those. And they're down in the lamina groove deep. And they're very, very helpful. Yes?
Are they both attached to the ribs?
Are they attached to the ribs? No. They are attached.
I guess I misunderstood.
It's okay. They're attached from a spinous process of one vertebrae to a transverse process of another.
Okay.
So when they work bilaterally, they help. They're on both sides, and they actually help to extend the spine, just like your spinal erectors. When they work unilaterally, they actually help to twist the spine. They actually help to pull this spinous process over here, and they actually rotate to the opposite side. And they are hard to visualize. Yes, go ahead.
So if a disc was being compressed, then it would help to loosen up those, right?
Yes. Yes.
Okay.
And disc compression seems to be an issue on a lot of stuff. Even if you don't have a blown disc or a herniated disc compression. When I went to massage school, it was like 25 years ago, and my teacher didn't tell us this stuff, but he actually told us some really good common sense stuff. And one of the things he always said is you're trying to make your clients taller. And that is actually a really good operating theory. He didn't really even explain why, but he's like, you want them to be taller and you want them to be able to smush them flat into the table because everybody should be able to lie flat on a table. And he was right. If they're medially rotated, I want to kind of open them up. And if they're compacted by gravity, which we're all under that force, I want you to be longer. You're all, by the way, about a half an inch taller in the morning when you wake up. And you lose it throughout the day. So anyway, so yes, it would be an excellent one to help decompress discs. Sure. And that's one of the reasons I like it. So you get the spinal erectors though too, right? The erector spinae group, because they're long and they're pulling the whole thing together too. But then, yes, you want to get the individual sewing done. Yeah. Well said. Yeah, exactly. And it gives you another layer of stuff to work on the back. There's really actually a lot of stuff to work on the back. There really, really is. And these help you extend your back. They also help you rotate a little bit, which, by the way, your erector spinae group extends your back, helps you flex, but still, you get the idea. They're very similar. They do similar stuff, and they're all under actually a lot of pressure. A lot of pressure. Okay. Please keep the questions coming. These are very good. There is a third muscle that falls into this category because it hooks onto transverse processes, and it's called the semispinalis muscle. Semispinalis capitis. Sorry, I had to think there for a second. Semispinalis capitis. And it is this muscle that kind of runs down through your transverse processes down here and goes right up to your head up here. And you can grab onto yours right now, essentially. If you grab onto the two ropes back here, there should be two ropes back there. Yes, you are grabbing onto your trapezius, but the rope-like feeling that you're getting is from the semispinalis capitis. They form the speed bumps of your neck. So you know when you look at the back of somebody's head and you see two kind of things on their neck coming down, or it looks like their neck is sunken a little bit, those two things are the semispinalis capitis kind of popping through underneath the trapezius. And I'm assuming yours are sore. Mine are.
What about the longissimus? Would you be grabbing that also when you're?
The longissimus is actually it's a little wider. It's a little more out to the side. So you might have grabbed it, but these are pretty surface. Yeah.
So are they going to be deep to longissimus?
You knew you were going to ask that. They are technically deep to the longissimus, and the fact that the longissimus kind of runs over it and kind of goes off to the side, but they are technically deep to it. But you won't feel them up here as deep. You'll feel them as just deep to the trapezius. So I know that was a very confusing answer, but the problem is, like, imagine the longissimus kind of coming up here and veering off over here. So yes, this other muscle is below it, but as it comes up here, it peaks out here anyway. So right here, it's not deep. It's not deep at all of that. But down here, it would be. The longissimus would be over the top of it. Yeah. But it's a fairly superficial neck muscle. It's right underneath the trapezius, and you can grab it.
So would it attach to C1 then, or is it the occipital?
Well, let's talk about it, actually. Let me see if I got a better picture. Okay. So these three, I'll answer that question, Ms. Petrie. I just want to show you a better picture. So the semispinalis capitis attaches to transverse processes in the upper thoracic region. We'll get the exact ones here in a second. And it attaches underneath the superior nuchal line, which is in your occipital region, so the back of your head. So it attaches these transverse processes to the back of your head. Again, your body has a big problem holding up your head. So there's a lot of muscles we're going to find help do this. Let's see if I've got something more exact here.
So it attaches under right where the trapezius would be attaching then, right? Because that is at the nuchal line?
Yes. Yes,
Okay.
yes.
So it's just under that?
Yes. Yes. In fact, you got a superior nuchal line. That's where the trapezius is attached. You've got, hold on, this is hard to see, but on our big head, this is the back of somebody's head. Oh my gosh. You've got, what did I do with all my pens? You've got a superior nuchal line, and you've got an inferior nuchal line. The trapezius attaches to the superior nuchal line. This muscle, believe it or not, semispinalis capitis, attaches between the superior and inferior nuchal line because there's a lot of stuff attaching back there. We're gonna learn about the suboccipitals later that are even below, kind of on the inferior line. So you're right, from a layer point of view, if you're at the back of the head, the first thing you're pushing through is the trapezius, and underneath that is the attachments for this, the semispinalis capitis. We are going to find out that about, depending on how you count it, just per side, there's, let me think, 4, 5, 6. It depends on how you count it, but there's about 8 muscles that attach on each side right around these nuchal lines. So this whole region is called the occipital region. How important is the occipital region to a massage therapist?
Very.
Very. Thank you. Yes, to me, it's almost a no-brainer not rubbing this area. It's actually one of, I kind of almost consider it like feet kind of thing. It's just a really important area to the body. There's a lot of stuff that attaches here. A lot of problems and stress come from here, and I'm always going to rub the back of your head where all these muscles attach in here. It's very sensitive on people. Most people really like it, but it provides them tremendous amounts of relief. Remember how I was so excited about the rear border of the axillary region because 7 muscles cross there. Well, this is one of those high priority targets. So I'm kind of giving this to you as ways to also think about massage too, because you only have 60 minutes in massage. Anybody can do a great massage in 4 hours, right? You ever had your kids massage you? They do a nice job, and if you give them long enough and they keep going long enough, they eventually hit what you want them to hit, eventually. But a really good massage therapist uses their 60 minutes better than another massage therapist. And so for me, that's why I don't spend a lot of time on arms and hands. I love them. I love them. They're amazing. But structurally speaking, they're a low priority to me, right? What's really a high priority to me is things like feet, hips, back, the occipital region. These are really, really, really important stuff. And since I've only got $60 worth of minutes to spend, I've got to think about how I spend my budget. Because if you spend it on stuff that's not as wonderful, they'll be like, that was a great hand massage. I really appreciate the 15-minute hand massage. It was amazing. But somebody else is going to come along and make their back feel better if that's the problem. So, by the way, I have spent 2 hours on a hand before, but that was because somebody wanted that. So yeah. Anyway, yes. So high priority area, semispinalis capitis, goes from the transverse processes of C4 to T5. Yeah, T5. So, 1, 2, 3, 4, 5. About here to here. Transverse processes, and then inserts between the superior and inferior nuchal lines, right back here. Right in the back of the head. And these make up the speed bumps of the neck that you feel back there. And they throw this into the transverso spinalis group because it attaches to transverse processes. Even though it doesn't look anything like the rotatories and multifidi.
I know how much you love my questions.
I do.
Okay, so you know how people have like the folds of skin in the back? Is that just because they have extra skin, or is that because their muscles are tight?
I suspect it's just because that's where they carry fat.
Okay.
Which we would say adipose tissue. But I would suspect that's just it. And they might have loose skin. And by the way, loose skin is just a sign that you have loose skin. It's not, it might be a good thing even. It doesn't really mean much of anything. Yeah.
Okay.
But yeah, it's just, yeah. I've never seen it as a connection to anything.
Okay.
What you will see though, is when people get a lump back here around vertebral prominence around C7, that is tension related, and that's fascia building up in that area because everything is pulling on it so hard that they're starting to build up extra fascia in that area, and they're actually getting, they call it a dowager's hump, but they're getting a lump back there.
So is that you would want to target the muscles in the front then to be able to release that? Or?
Oh, I like that idea. You'd also want to, like, I know this sounds very archaic, but you'd want to beat the snot out of that area because I want to break up this fascia. And it's been forming there for a long time. But I agree, you'd probably want to hit the front too. Yeah, this whole area is going to be locked by that point. And by the way, you don't tell the client, oh my gosh, you've got a huge lump on your back, we're going to work on that. You just go, I see there's some tension here, you know. Yeah, you always have to kind of tiptoe around this thing with clients, like letting them know what you found, but also not making them feel bad, you know.
Mm-hmm.
Yeah. Anyway, I like your thinking. You're absolutely right. You would look in front, but also you just kind of deal with the fascia back there too. Remember, there's like multiple levels, right? One is that we tend to think about the problem area. You should work on the problem area. And then I like what you were doing. You're going to the next level, which is what could be aggravating the problem area, the opposite of it. Yes. And then also the nerve component. Could there be nerves pinched that are also affecting that? Sure. Cool, cool, cool. Okay. So, really quick, back to semispinalis capitis. Its job is just to extend your neck, really, because your head weighs about 10 pounds. Yep. And it attaches to these transverse processes, things sticking out the spine, of C4, C5, C6, C7, T1, T2, T3, T4, T5, and it goes up to the back of the head. And then we've got the multifidi and the rotatories. And this is actually a pretty good diagram of them. And they go from the spinous process of one vertebrae to the transverse process of another vertebrae. And how does your book put it? Multifidus tab 2 to 4? Yeah, that's what I said. And the multifidi tend to go from this vertebrae up here and drop down 2 or 4. The rotatories go from this vertebrae up here and drop down just 1 or 2. They're shorter. And the multifidi, the multifidi, are found on the sacrum. I know that'll be a test question, and I'm glad it's a test question because you should be rubbing the sacrum to work on the multifidi. I know, that's why I say it, Miss Cooper. That's where I got it. My high school students were like, it's like 50 cent. And so I started saying multifidi, but now I can't unsay it. And thank God for Mr. Kandaris to at least set me on the right track. Okay. Anyway, I was just thanking you for telling me actually how to pronounce multifidi properly. Anyway, so these are the shoelaces of the back. And I don't sit there when I'm working on them and go, oh, this is a rotatories or a multifidi. I'm just like, I'm now down at this layer. Like, they're very hard to fill. They're tiny. But again, it's a really good layer to get down to. Cool. Cool. Questions, thoughts?
Can you explain the actual, I guess it would be insertion or origin of the multifidi and rotators?
Yeah. Let me see if I can do it with tape. Might help you. Oh, wait, I got to get my spine. This will help a lot. Okay. Good. Okay. All right. So, they go down the entire back, Miss Petrie. So there's shoelaces down the entire back. And both of them attach a spinous process to a transverse process. So let me show you what that looks like in two different forms. So let's take the small thing first so we can see it better. This is just two vertebrae. This is a spinous process right here. And if we went diagonally down, we go down to this transverse process. It just attach, and that way, by the way, if it pulls on both, well, let me do both sides for you. There. So it's a little diagonal muscle that goes, but your pull back's full of them, and we're about to do it on the spine here more so you can see more. So if both sides pull, they pull this down, which is actually an extension of your back. If one side pulls, it'll actually rotate you to the opposite side. But it looks like a little shoelace on both sides. Now this one would have to be, which muscle would this have to be, Miss Monreal, of the two?
Like, what do you mean? I'm not sure what your question is.
Well, is it is this yellow tape a multifidi or a rotatories?
I feel like it's the rotator.
Why do you feel like it's the rotatories?
I'm just trying to picture what I saw on.
You're right.
On the book page.
This one is a rotatories for sure because it went from one vertebrae just one down to the next one. And rotatories only jump one or two vertebrae. Multifidi jump 2 to 4. So they tend to jump. So I'm going to show you that on the skeleton to make it more clear.
Are they the skinnier ones, the multifidi? Or the thinner ones?
They're longer. I don't know if that makes them skinnier. Okay. Yeah. So this is going to be rotatories. I'm going to come down maximum 2 here. There. Another rotatories. Maximum 2. Now, I don't have time to take this whole thing off because you've got hundreds of these, right? They're like shoelaces all over the place. But this is going from the spinous process. Oh, I lied. There. Spinous process and dropping down just 2 vertebrae over this transverse process. The multifidi do the exact same thing. They grab onto a spinous process too, but they're longer shoelaces. They like to go from 1 often down to 2 to 4. So they look much longer, like that. And of course, in your human body, they're all together. So underneath these rotatories, you've got multifidi over the top of them. Which means you got tape going everywhere. That's why they really are the shoelaces of the back. It's like they're attaching these things all over the place. And it makes for very powerful spinal erectors under here. So even though they're small, they're mighty because there's so many of them. Does that help at all, Miss Petrie? I know it's a hard thing to visualize. And these yeah, go ahead.
So maybe like gently getting your 2 thumbs or fingers and working over the spinous process would be good for that attachment? Yeah. Actually, I'll often come at the spinous process. You're absolutely right, and kind of scoop down here because I'm trying to push the spinalis and the longissimus away and scoop down in here, and I'm trying to get into the lamina groove. Into the lamina groove, which is the groove that's just created between your transverse process and your spinous process. It's this groove down in here. And yes, exactly what you said. I like what you said, actually. You get up here on the spinous process and try to kind of like act like you're trying to scoop this area out. Yeah, be a very good effect. What?
Are we gonna learn that today in lab?
Yeah, well you could just do it today in lab. Like it's something you just have to feel. I'm not trying to give a cop out on the thing. Ask Mr. Ibarra, but it's like just the kind of thing like Miss Monreal was just saying. Find the spinous process and see if you can scoop down in here. Because the problem is, even when you do it, we won't be able to tell you if you're actually doing it. You have to kind of just feel around. But you'll feel these rope-like things over here, the spinal erectors, and you'll get them out of your way, and you'll feel more stuff down in here. Yeah. You'll feel another layer. Yeah.
So it goes all the way down the back.
Yes.
Over the multifidi.
Yeah.
One goes over the sacrum, does the other one just attach to the sacrum?
Yeah, the other one just stops.
Okay.
It matters for what I want you to remember is there's muscle on top of the sacrum that is a continuation of this concept. But you're right. The rotatories kind of stop like down here like this. And hold on, I'll show you. So the rotatories kind of stop down here like this, and the multifidi then would keep going, and they actually cover the sacrum, kind of tie it in down there. And there's lots of it, so you want to rub this whole area. Sacrum's super important. Look at this sacrum. Do you guys see? Hold on. Do you see what's popping out from little holes in here? These are called sacral foramen. They are actual holes in your sacrum. They're kind of like the holes in the side of your spine here. They're very much like that. And these are nerve plexes that feed the whole back of your body. These guys can get pinched literally under the multifidi. So you want to rub this area because there are nerve endings coming out right out of that area.
Okay.
Yeah. That's a high priority target too. I mean, around this sacrum, just the fascia alone, the thoracolumbar aponeurosis is super important. But then you've got the multifidi here, attaching here. You got the glutes coming off here. Your piriformis, which we're going to learn about later, can pinch your sciatic nerve. It's right here on the edge of your sacrum. There's a lot going on back here. I could spend an hour just around here, 2 hours, 3 hours around this area. This is a fascinating area of the body. I actually can't wait till we get to it.
Question.
Yeah.
So when you say something about scooping into something to get to something, I don't know, I definitely want to see this in lab because we've been told to kind of like not stay away, like kind of the Richter spinae, like we push down on the sides of the spine, but you're like scoop into the spine. I
Yeah.
don't know.
Yeah. Yeah, you have been told, I'm sure. I would have told you the same thing in the beginning. In the beginning, we're like, don't hit the spine. Don't hit these
Right.
bones. And then later, we were like, hit the bones. Because we're hoping you can hit them judiciously. And here's what I mean by that. If I'm rubbing, I know this wasn't your exact comment, but if I'm rubbing the sacrum, I would not rub into it. That would be very annoying. But I might try to scrape stuff off of it. So it's about angles. And brand new students, we worry about them getting that. And of course, I don't want to run into these spinous processes. It's very painful. But later, when you get good and know where they are, you can find them and fall off them and use them to leverage muscle off them. And that is exactly what you're trying to do is pry. Because if you work on the sides of the spinous processes, you are prying the multifidi and the rotatories off them. And you are right where you want to be. So later, we actually do want you to kind of play with that stuff, so to speak.
That's awesome. Thank you. I can't wait to feel that on myself because that is my problem area.
Yeah, I don't know if I've ever met a client who didn't like that kind of work. I'm sure they're out there because there's always something I'm like, this is the greatest thing ever, and there's that person who's like, I hate it. But most people love it. They love all that stuff deep inside their back because think about it, you want to scratch and itch for them that they can't reach and that no other therapist has reached. Right, and this is one of those layers. Yeah, cool. So that's the multifidi and the rotatories. Miss Petrie did a good job summarizing them, summarizing them, where you said that like the multifidi go down onto the sacrum, the rotatories don't. The rotatories jump from a spinous process of one vertebrae down one or two more. The multifidi go for a spinous process of one vertebrae and drop down two or four more vertebrae before grabbing onto a transverse process. They're just longer shoelaces. Multifidi are longer shoelaces that lace up all the way down to the sacrum on top of it. Besides that, they're indistinguishable and you will not be able to feel the difference on the back. But all you got to remember is there's something connecting spinous processes to transverse processes so you can loosen them up. And they are under the erector spinae group. Yeah? This is where anatomy starts to pay off in your massaging. Okay. So we had three transverso spinalis group muscles. We had the multifidi, the rotatories, and the semispinalis capitis, which meant it goes from the cap, your head, part down of your spine, grabbing on the transverse processes of C4 through T5. C4, C5, C6, C7, T1, T2, 3, T4, T5. Kind of right here. Yep. And this is actually, I don't know if you can see this. This is actually a pretty good picture of the nuchal lines. These lines back here are nuchal lines. And so this thing's grabbing on right up in there. Right underneath them. That's the semispinalis capitis. And the trapezius is right up above them. And on top of them. Everybody take a break. Your faces look like you need a break. I don't mean that as an insult. Take a break. I'll see you in 10 minutes. See you at 10 o'clock. Just don't be late. Don't be late. Let's hop over a few other little things here real quickly. Transverso spinalis group, right? What were the three muscles that make up the transverso spinalis group, Miss Monreal? The three, yeah.
In capitis,
Semispinalis capitis, yes.
spinous capitis, rotaries, is that how you say it?
Rotatories is what I always said, but yeah.
Rotatories, and then the multifidi.
Thank you. Mr. Kandars,
Here, sir.
what are the three muscles that make up the transverso spinalis group?
Semispinalis capitis, multifidi, and rotators.
I'll take it. Thank you, sir. Miss Hunter? Hi. What are the three muscles that make up the transverso spinalis group?
The rotatories, semispinalis capitis, and multifidi.
Thank you. We'll take it. Miss Yanez, what's the difference between the rotatories and the multifidi?
Multifidi can span between 2 to 4 vertebrae, and the rotatories are 1 to 2.
Thank you. And Miss Petrie, what is one other difference? Miss Yanez told us the exact truth between the rotatories and the multifidi. The rotatories are shorter, and they jump between 1 and 2 vertebrae when they cross over, and the multifidi jump from 2 to 4 when they cross over. But what's one other difference between these two muscles?
The multifidi cover the sacrum.
Thank you. Beautiful. Both of you. Beautiful. Excellent. That's exactly what I wanted to hear. Miss Stanley, what are the three muscles? Sorry, I know you're eating. What are the three muscles that make up the transverso spinalis group?
My bad. The semispinalis capitis and the multifidi and the rotatories.
Beautiful. Thank you. Awesome. 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 Okay. Let's move along here. So, these are most easily found in the lamina groove, right? Especially in the thoracic and lumbar regions. So when you're looking for them today, look in the lamina groove. And by the way, I think Miss Monreal is talking about finding them not the way this person's hands are finding them. In a way, she might actually even skip over the spinous process and scoop away from that, which would be an excellent approach. By the way, both would be a good approach. I really like her concept, though, because you can find the spinous process and you can slide down it. I really like that. Very clever. Okay. And usually this is work you do with your hands, with your fingers, because they're tiny. Get in there. You can sometimes get your elbow down in there if you're really, really good. Okay. We already talked about this. Really quickly, I want to talk about two other neck muscles. And hold on, I want to see if I tell you what layer they're at. Did I? No. Hold on, everybody, bear with me. Yeah, let's see here. Splenius cap, yep, okay. All right. I didn't. Anyway, we have two other neck muscles, the splenius capitis and the splenius cervicis. So remember, by the way, we've now heard three muscles with the name capitum. Semispinalis capitis, splenius capitis, I'm sorry, two muscles with the name capitum, and splenius cervicis. The ones with cap in them actually go to the thing that you put a cap on, a baseball cap on, your head. The splenius capitis goes from the spine, right, to the head. The splenius cervicis goes from the spine to the cervical, cervicis. Do we see this in the picture? Do we see that the splenius capitis essentially has an origin of C7 to T4? Oh, it really should be higher than that. Oh, they're saying the ligamentum nuchae. Okay, so they're saying half of the ligamentum nuchae. By the way, I hope this is going to make sense what I'm about to say. There are many different ways to talk about origins and insertions, and it gets very confusing. But you've got this thing called the ligamentum nuchae, and people think of it, we've talked about it before, but, shoot. I just cut my fingernails this morning and I cannot get the tape up now. Okay. People think of the ligamentum nuchae as the thing that goes from the external occipital protuberance down to C7. And that is true. But what they don't realize is it's not just a band here, it actually is, it's very thick. And so it actually looks like this. And so it attaches to all the spinous processes of your cervical region. So when we say something attaches to the ligamentum nuchae, we're saying it attaches to the spinous processes of your cervical region too. They're all the same as far as I'm concerned, as far as anybody's concerned. It looks much more like that. Does that make more sense? So if you would grab onto this, you're grabbing onto these processes too, because that's where it attaches. So, yeah, go ahead.
So, just to recap, ligamentum nuchae is basically the spinous processes.
Yeah, it kind of is. It's a ligament that attaches the back of your head to all the spinous processes of your cervical region all the way down to C7. It really weaves into all this. It helps support your neck. And so when your book has something that says, hey, the splenius capitis attaches to the inferior one half of your ligamentum nuchae and C7 through T4, it's really saying, look, it really attaches to, I mean, it's hard to say exactly, but it attaches to C4 through T4. It's really attaching to all these.
Saying ligament helped.
Yes, it is a ligament because it attaches bone to bone. The ligamentum nuchae does. Attaches bone to bone. Yeah, and it's there to actually give your neck support. So, your splenius capitis looks kind of like this. And like this. There we go.
The yellow tape is...
The ligamentum nuchae.
Okay.
Yeah. Just to give you an idea of how that really works. And this is the splenius capitis. The splenius cervicis doesn't have the word capita. It doesn't go to your head. Splenius cervicis goes from your spine to your cervical region. Splenius cervicis, right? So spinous processes of like T3 through T6 and back into your transverse processes of C1 through C3. It's meant to help tie your neck to this area. Yep. You can see why you need all this stuff, by the way, because you're trying to hold your head up, and it's actually a very tricky thing to do. And then remember this, oh geez. And then remember the semispinalis capitis. By the way, I don't personally worry about what group these are in or anything. I just remember that they're back here. Sorry, everybody. All right, let's try this again. So, and then remember you got the semispinalis capitis from the other group that's back here too. And then remember over the top of all this, you got the trapezius. This is all underneath the trapezius. It's a lot to think about. But the splenius capitis goes from the spine to the head. Splenius cervicis goes from the spine to the cervical vertebrae. If it helps you remember it all. And here's the good news from a massage therapy point of view. They all kind of insert between the mastoid process, which is these bumps on the side of your head you can feel right here. And if you follow these bumps back, you are running across your nuchal lines, your superior and inferior nuchal lines. This is the area you want to be focusing on to hit the splenius capitis and the semispinalis capitis and the longissimus. And later we're going to learn about the suboccipitals. And all of that stuff is back in this area. So it's really important to work for the mastoid process along these lines back here. Yeah? Yeah, sorry, it's a lot to throw at you. But I want to introduce these for you before you take like small quizzes on them and things like that. Cool? So if a muscle has the word cap in it, where do I know that that muscle must attach to? Miss Nguyen. Miss Nguyen, if a muscle has the word cap in it, capitis, cap, where must that muscle go?
In the close to ear come to
Oh, yeah. That was a better answer than I was expecting. Not because I don't expect good answers from you, but I meant like it goes to your head. But
Yeah.
you're exactly right. She's telling us it's going to go, I love it, the bump close to your ear along this area here, this superior nuchal line. Good. Excellent. That's what I want to know. Right? Awesome. Cool, cool, cool. And the splenius capitis and splenius cervicis are going from spinous processes to your cervical region or your head. The semispinalis capitis was going from your transverse processes to your head. In fact, it should be more like this, which is why it has that straighter up and down kind of look. Cool? Kind of, sort of, a little bit. This is a good picture of them underneath the trapezius.
Will you explain the splenius cervicis, the attachment again? I'm sorry.
Yeah, essentially. So I think, by the way, I don't know if this is what's throwing you off, Miss Petrie, but I think it's throwing off some people. So let me make sure. It's very important that we remember how a vertebrae is made. When you guys are rubbing a back on somebody, you're rubbing this part right here. These things that are poking out to the side are called what, Miss Petrie? These bumps that poke, I'm sorry, not the side, poke straight out the back that you try to avoid.
The spinous processes?
Thank you, 100%. These are spinous processes. And there are things that poke out to the side that you might not actually feel on somebody. They go out to the side. Transverse processes, cool. All right, so very simply put, the splenius capitis attaches spinous processes to the head, to the capitis. Splenius process, spinous processes to the head. Spinous headis, splenius capitis, right? Splenius cervicis should be like this. To make sure. Yep. Splenius cervicis attaches spinous processes back here in your back,
Yes.
kind of your upper thoracic region, to transverse processes in your neck. Spinous cervicis, spine cervical, splenius cervicis. So both start on, oh, go ahead.
Do they have an exact attachment?
Yes, do you mean exactly where does the splenius cervicis attach?
Yes.
Yes, sorry. It goes to the transverse processes of C1, C2, and C3.
Okay.
Yeah.
And does it travel all the way down, or is it just in? I think that's where I'm confused also.
Sorry.
No, you're fine.
Its origin is the spinous processes of T3 through T6, which is actually right where I have this tape. I did pretty good. It's these spinous processes of T1, T3, T4, T5, T6, right down here. So it does not go all the way down. It doesn't even get down halfway down your back. I mean, it stops right here.
So
It is this black tape here.
The spinous cervicis.
Splenius cervicis.
Yes, splenius cervicis attaches the spinous processes to transverse processes of C1, C2, C3. And
Yes.
then its origin would be T3, T4, T5.
T6 too, I think. Yep, T6. So let me restate what you just said, Miss Petrie.
Okay.
Because you said it correctly, but you said, I would change the statement to say this. The splenius cervicis
Okay.
attaches spinous processes to transverse processes. It attaches the spinous processes as an origin, has the origin or attaches the spinous processes of T3 through T6 to the transverse processes of C1 to C3. Spinous processes of T3 through T6 to the transverse processes of C1 through C3. That would be the technical way we would say it.
Okay.
And everybody, you know how you get all those tricky test questions about rotating to the same side and all that kind of stuff?
Yeah.
This muscle is found on the same side, so it's going to rotate to the same side. Like, when it contracts, it's going to turn the head like that. Both of them will. They will rotate to the same side that's contracting, that's shortening. So they usually work together when they're rotating, or laterally flexing even. Or extending. It's a lot of muscles. I mean, we just threw in multifidi, rotatories, semispinalis capitis, and then we threw in these two new muscles, splenius capitis and splenius cervicis. These two new muscles attach to spinous processes and either go up to your neck or up to your head. So yeah, it's a lot. And I'm hoping there's one more muscle I want to tell you about that's even deeper than all these. So, if you tear off the splenius capitis, goes from the spinous processes to the head. You tear that off, and you tear off the splenius cervicis, and you get rid of all the rotatories. The deepest layer of muscle, and I'm not sure you can feel this, although I think you can feel the tension from it. So, you have a group of muscles that are basically found in your cervical region and your lumbar region. They're not found in your thoracic region. They're not found in your thoracic region probably, I mean, I don't know God's master plan, so I could be wrong, but your thoracic region has a lot of support given to it by the ribs. We don't think about this a lot, but my thoracic vertebrae are supported by my sternum in front. There's ribs that attach around here. So that's why it's harder to bend at your thoracic area. You bend down here in your lumbar mainly, and your neck. My neck can move a whole lot more than my thoracic area can, because there's a rib cage here, but it makes it stronger here.
That's so weird that a muscle that goes to the spine skips an entire thoracic area.
And this is why I believe it does. It's because the thoracic area does not need as much support. So, you know how everybody's into core strength, core strength, core strength? Well, they're into that reason because there's nothing here in front to help your lumbar region. Your abs are the support in front for your lumbar region. But your ribs come with their own second spine in a way. Like, you've got a thoracic spine back here, but you've got an immobile spine up in front that helps support your thoracic region. So, you've got these things called intertransversari. They run between the transverse processes of your cervical and your lumbar vertebrae. That's all they are. Tiny little muscles between the transverse processes. Intertransversari. I think they're very important actually, but you probably won't hear people talk about them very much. They're really very, very hard to get down to. I think you can technically do it. You'd have to get down deep enough to actually feel the individual transverse processes and then kind of poke in between them here. I can tell Miss Monreal's going to try, and that's what's important. And they're called intertransversi, and they go between the transverse processes of your vertebrae, the lumbar and the cervical region. Don't overthink it. You don't have to memorize L1 to L5. That's just your lumbar region and your cervical region. And that's because those areas need extra support. They don't have a rib cage supporting them. So if you have an intertransversi, of course, you have an interspinalis. And those run between the spinous processes, actually between them. This is a very hard area to get down to because you've got ligaments over the top of this stuff too. And that's called interspinalis. So you got intertransversi and interspinalis. And the interspinalis and intertransversi essentially go in the neck and cervical region too. They overlap a tiny bit in the thoracic region, but don't worry about that. I'm never going to ask you about that, whatever. Interspinalis, intertransversi are muscles found between these processes in the cervical and lumbar area. That's it. We've gone down as deep as you can go. We're going to hit bone now. And that's it for today too. That was a lot. A lot. And all these do is attach from here to here, these little areas. And they too help you extend your spinal column. They help you bend backwards. It takes a lot to pull yourself back like this. So, can I recap the 400 things I've told you about today? If you don't mind. Okay. So, today, we left the world of the erector spinae far behind. We had these 3 erector spinae muscles on each side of the back. Nice, long, beautiful muscles. We might have already forgotten they too were made up from small muscles too, and they look kind of like a tree. But really, as far as massage therapists are concerned, and most people, they're essentially singular muscles. And we have 3 erector spinae muscles on each side of the body, right? The one closest to the spine is called what, Miss Hansen?
The
Spinalis.
spinalis.
Yep, awesome. And Miss Torres, the one next out laterally, not furthest out laterally, but next out laterally, that attaches into the mastoid process.
Longissimus.
Longissimus, thank you very much, which is my favorite of those 3. And then the one out most laterally, Miss Cooper, is what of this erector spinae group?
Sorry, repeat that.
The most lateral of the 3 erector spinae group muscles.
The spinalis.
Not the most medial of the 3.
Sorry, the longissimus.
The most lateral of the 3 muscles. It goes spinalis, longissimus, then what?
Iliocostalis.
Thank you. Attaching the crest of the ilium to the costals, iliocostalis. We ripped all those off. And we got to the shoelaces of the back. The shoelaces of the back are formed by 2 muscles. I realize there's 3 in this group, but the shoelaces of the back are formed by what 2 muscles, Miss Stanley? Rotatories and multifidi, or rotators. I'll take it. Awesome. And Miss Felix Osuno, how do I tell them apart? The multifidi and the rotatories.
So for the rotator, it goes from span 1 to 2 vertebrae.
Yeah, they don't go very far. They're short, and they jump just 1 or 2 vertebrae and go to the next one. They go from the spinous process out diagonally, just 1 or 2 vertebrae down. And then the multifidi, what do they do?
Those are span 2 to 4 vertebrae.
They jump further, so they jump down at least 2, sometimes 4. Yeah. And what else? What's the other difference? Give me one more difference.
Was the one that goes all the way to the sacrum or something?
Yes, which one goes all the way on the sacrum?
Is it the Multifying?
Yeah, it is. Multifidi goes all the way to the sacrum, which is one of the reasons we rub the sacrum. There's a lot of important nerves coming out there. Cool. And then don't worry, I haven't forgotten about the other muscles, but I want to keep going in this direction for a second. Then if we tear these off and we go even deeper, we get to these muscles that run between processes. Inter, between, right? Like interstate transport between states. Intertransversari and interspinalis. And that's our deepest layer. I'm going to come back to the other muscles I left. But so we kind of have spinal rectors, rotatories, multifidi, and then interspinalis and intertransversari. From a layer kind of point of view. Then I'm going to come back and talk about this neck, because this neck gets kind of confusing. In this neck, we kind of learned about 3 head or neck muscles. I'm mixing groups now, but 3 head or neck muscles. We learned about the semispinalis capitis, which goes from the transverse processes down here to the head. And it makes the speed bumps of your neck. It's underneath the trapezius, but actually is what gives you those 2 ropes down your neck. Then we learned about the splenius capitis, which goes from the spinous processes here to your head. And then we also learned about the splenius cervicis, which goes from the spinous processes in your back to the transverse processes in your neck. And I think if you look at our skeleton here, you can see why this might make a lot of sense. You've got these muscles wrapping around here, helping to hold your head up. Yeah? I don't expect you to memorize all that. I just want you to visualize it and kind of digest it now. Right? We're going to have to come back to it, I think. But cool? All right. I want to release some open book test work for you guys so that you can work on it in class and it's not so overwhelming for tonight. And I can be